Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC. Grab yours today!
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Good day everyone, I am Beth. And today, kasama ko po si Ma'am Mabs to tell her cancer journey. So, hello Ma'am, good day po. Kamusta po kayo Ma'am?
Okay naman. Ngayon okay ako. Malakas.
So Ma'am, can you tell me something po kung sino po ang isang Mabs?
Ako po si Ma'am. Nanayagnose po ako ng cancer noong November 2023. Ang simula talaga ng aking nararamdaman noon ay sa ipin lang. And then, ayun, nakita na may cyst na, may bukol na ako sa gum. Pagkatapos, required naman ako for MRI. Lumabas sa aking result na mayroon nga naman akong osteosarcoma. And then, na-confirm nung myopia ko na ito ay adenoid cystic carcinoma. Which is rare daw yun, sabi nila. May possibility siya na umakyat sa pataas at kumalat pa sa pababa ang liig. Nag-undergo ako ng operation, which is tinanggal yung kalahati ng nalagal ako. Kaya ganito ako magsalita.
Paano po ninyo na-meet or nakilala si Dr. Jansen and yung Simply Nature PPARS?
Kilala ko po si Dr. Jansen at na-meet ko po yung Simply PPARS. Dahil po nanonood ako sa Facebook, nung nag-tape na ako ng Simply PPARS, talagang malakas po katawan ko. Simulan sa po, hindi ako sinipon, hindi ako nilagnat. As in, malakas ako. Talagang maraming na-amaze sa akin. Pumayat ako sa treatment ko, pero nakikita nila na malakas ako. Kaya pati yung mga team na radiology, ang sabi sa akin na maganda daw yung malat ko, hindi daw nasunog. Dahil yun sa Simply PPARS. Kasi yun ang katuwang ko. Ako'y nagpapa-radiation. Sa umaga, radiation ako. And then sa gabi, nagtitake ako ng PPARS. Dati, ang required sa akin ay chemo at radiation. Pero nung nakita na on ko na nag-stay lang yung at walang kumalat kahit sa party na katawan ko, radiation na lang, na-required sa akin. Kaya yun, papasalamat talaga ako. At nakilala ko yung Simply PPARS at si Dr. Jansen. Malaking tulong talaga. Parang hindi ako nagpapagod. Kilos ako ng kilos, ako naglilinis, ako nagluluto, at namamalimsi pa ako mag-isa. Pero kilos pa rin ako ng kilos, parang hindi ako maisip na, may uuupin ako na, may ganito ako, gano'n. Dati kasi may osteoarthritis na alam ako. Pero mula nung nag-test din ako, nawala lahat yung nararamdaman ko. Malakas ako at maganda yung tulog ko. Talagang pahagising mo sa umaga, wala ka nararamdaman na, masakit yung ganito ko, ganyan, di ba yung kapag nagkakaedad na tayo, masakit yung tuhod, masakit. Ako asin wala parang fresh, parang bumata ang pakiramdam ko. At marami nagsabi, mas naging blooming lang ako ngayon. Dahil yan sa pagsisin ko na Simply PPARS. Ako po, si Ma'am, nanayagnos ako na adenoid cystic carcinoma. After ko maoperahan, nag-take ako ng Simply Nature PPARS at noon po ako lumakas. Napabilis ang aking paggaling. Kilos ako ng kilos. Nakakalimutan ko na may sakit pala ako o naoperahan ako. Kaya sa Simply PPARS, lumakas ang katawan ko at napabilis yung paggaling ko. And I trust Simply Nature.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC. Grab yours today!
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. No? The main reason why I tried PPARS liquid, and it did well for the patient. No? It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.
Hi everyone, I'm Sheila and welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by Simply Nature International and Simply Healed Medical Group. Just a recap on our last week's topic. Last episode we discussed natural and conventional treatment, combining treatment to beat cancer. Lots of questions were asked and most importantly answered by our experts. And this week, discover how cancer patients can benefit from PPARS because tonight's interesting topic is entitled Pediatric Cancer, Finding a Better Solution to Give Our Young Ones a Better Future. Pediatric cancer touches the lives of over 400,000 children and their families each year, making it one of the most heartbreaking and urgent health challenges young patients face. Despite incredible medical advancements, cancer tragically remains the leading cause of disease-related death in children. The fight of survival varies drastically depending on where the child is born and the child care available for them. In some cases, hope shines as to high as 80%, while in other places, as low as 20%. This heartbreaking disparity is a reminder that we must do more. This webinar will dive deep into the latest breakthroughs and innovative solutions, striving to close this gap and ensure that every child, no matter where they are, has the chance for the healthier and brighter future. We extend our sincere gratitude to each and every one of you for tuning in to this webinar, and we encourage you to share this online event to your friends and loved ones who will benefit from the insights shared here tonight. So, without further ado, let's dive right in. Please note that we will be having what we call AMA or Ask Me Anything portion. So please feel free to drop your questions on the comment sections. Leading our discussions for tonight are distinguished health experts. First up, I'd like to introduce, of course, our CEO of Simply Nature, Mr. Shyan Lim, and of course, our lifestyle medicine doctor, Dr. Jansen Kalala. I am honored to share a story that is deeply moving, but one that speaks to the resilience, courage, and hope that define the journey of pediatric cancer. Let us all watch this.
All right. So what we're going to have on tonight's program is we're going to have a one-on-one interview between Sheila and baby Jhen's mom. You're going to hear all the details about what baby Jhen had. 3 months old. So, in this program, over the last 2 years, we've talked about patients who have cancer from all ranges of ages. But this is the youngest.
So, without further ado, I would like to call on Miss Edna Balayas Ayawan. Hello, Miss Edna.
Hello, ma'am.
Miss Edna, can you please tell me ano po ang exact diagnosis ng ating baby at sino ang ating special na patient?
So, ako po yung mother ni Jhen. Ang aking anak po ay 3 months when she was diagnosed with hepatoblastoma stage 3. That was on March 31 this year, 2021. So, sa kaniyang case, napakahirap ma-determine na meron siyang karamdaman na hindi mo akalain na ganun kalala kasi when she was first and second month, napaka-active niya. Wala naman obvious na makikita mo sa kanya na mapapaisip kang there's something wrong within kasi she never had jaundice, never siyang nagkalagnat. Walang iba. Ang isa lang talaga na nung una pa lang na napansin namin since birth niya is iyak siya ng iyak na hindi namin alam kung ano yung reason since hindi naman niya masabi. So, pinapamper lang namin siya with yung breastfeeding or dancing, singing, or kung ano-ano yung ginagawa namin para mapatahan. We also ask advice from our friends or even her pediatrician kung bakit siya laging umiiyak. Ang sinasabi lang sa amin is yung growth spurt raw na normal sa mga babies. Eventually, pag lalaki daw siya, makaka-adjust siya, then magiging okay. Mababawasan yung pagka-irritable niya, hanggang sa hindi mababawasan na rin yung pagiging maiyakin niya. But when we went to the pediatrician, when she was about 2.5 months na magpapavaksin lang sana siya, napansin ng pedyan niya na maputla compared noong bagong silang kasi monthly na nagpapa-follow up kami. Maputla at saka medyo distended na yung kanyang abdomen. From then, doon kami nag-start ng workup like blood test, ultrasound, hanggang ma-CT scan and ma-work up sa hospital. Doon na na-diagnose na meron siyang stage 3 na yung kanyang tumor sa liver.
Bilang gradual kasi
So
talaga
yung sabi ng kanyang pediatrician, even the oncologist, na yung hepatoblastoma is makikita mo lang or mapapansin mo lang on the late stage na. So as a mother, parang lalo na first time, parang normal lang pero hindi ko pala alam na ganun na pala kalala. So upon diagnosis, nasa hospital pa kami noon, nag-start na agad ng kanyang chemo session. So she went through 10 sessions of chemotherapy. Ang dapat lang sana sa kanya is 8 sessions. Kaya lang, when we went to the surgeon, in-advise niya na kung pwede pang ma-extend ng at least 2 sessions pa para mas lalo pang mapalit yung kanyang tumor. Kasi the smaller yung kanyang tumor, the better yung kanyang recovery. So we went through another extension na 2 sessions, so a total of 10 sessions lahat. At sa kanyang 10 sessions na yun, there were so many side effects na kung hindi makokontrol, mas lalo pang mapalala yung kanyang health situation. Kasi may diarrhea, may vomiting, may siyempre loss weight, may loss of appetite, may sore sa kanyang oral cavities na dahilan na hindi siya nakakain, hindi siya nakakadede or nakaka-take ng kanyang mga medicine. So hindi biro yung pinagdaanan, lalong-lalo na baby siya, hindi niya masabi kung ano yung nararamdaman niya.
I agree. Wala pang 1-year-old si Jhen to have undergone those kind of complications, chemotherapy ng mga adults, di ba? Medyo hindi ganun kadali. Kailan kayo unang nag-take ng PPARS at paano nyo nakilala ang PPARS?
So, after ng kanyang chemo sessions and after ng CT scan na sana mag-undergo kami ng surgery, nag-consult kami ng almost 3 surgeons at tinanong namin yung percentage na at yung assurance kung maoperahan si Jhen. But they never assure us na it will be 100% successful. At meron pa kaming kakilala na more than 2 years old and unfortunately he kasi lalaki siya, he was not able to recover after surgery, na it even caused na para maano siya, mamatay siya after surgery kasi nagkaroon ng liver failure. So inisip namin na 3 months lang yung anak namin, how much more yung papagdaanan niya sa napagdaanan ng older than her. Kaya we tried to search sa social media kung ano yung pwedeng makakatulong sa amin na which is not very risky at saka complicated sa anak namin. And then after how many days and even weeks of searching, nakita po namin yung PPARS na we believe it's God lead us, para God make a way para hindi maoperahan yung anak namin. We decided to try muna while waiting for the operation kasi we really are afraid of na sa complication at saka risk ng operation niya. So, nung nag-try kami, nag-consult, and then immediately we tried na mag-take na siya ng PPARS. That was September 25, 2021.
Mami, after po noon, na nakapag-take si Jhen ng PPARS, ano-ano yung mga naging napansin nyo na pagbabago sa kanya?
So, when she started taking PPARS nung September 25, we decided na i-try at i-monitor siya within a month. So, within a month, after 1 month, October 25, blood test and ultrasound kami. And we really thank God na there is a big improvement. For me, it's really a blessing yung PPARS because yung dating alpha fetoprotein niya na tumor marker ng liver cancer, which is 65, it went down to 14. So, almost 4 times yung kanyang binaba na from 65 to 14. At ang kanyang ultrasound din, lumiit din yung kanyang lesion. Before siya nag-take ng PPARS, it was 3.6 by 4 by 3.5 centimeters. After 1 month lang, malaki din para sa amin yung binaba niya na naging 3.1 by 2.8 by 2.7. So almost 1 lahat, yung 1 centimeter, yung 1 centimeter, kahit 1 centimeter lang yun, malaki na yun na pagbabago kasi 1 month pa naman eh. So aside from sa pag-decrease ng kanyang lesion, meron din kasing nakitang nodule sa kanyang spleen that measures 1.7 by 1.9 by 2 centimeters. After 1 month na sa pag-ultrasound niya, it's miracle for us because it's totally gone. It totally disappeared. So we are thankful, forever thankful for leading us to PPARS kasi we believe na ginamit ni Lord yung PPARS to help us na hindi mag-undergo ng surgery yung baby namin. And also we are so happy because we see a lot of improvement na her hair is growing, she start to gain weight, she is happy, she is active. So what more we can ask? We decided to continue na mag-take siya ng PPARS na hindi na siya mag-surgery hanggat nag-i-improve siya. We will continue to take PPARS.
Thank you, Lord, for this.
Thank you, Lord talaga. Si Lord lahat ang mag-glorify sa mga nangyayari sa anak namin kasi we were hopeless before knowing PPARS, but God lead us para in an alternative way na hindi ma-risk talaga yung anak namin. Sa mga katulad ko na mother or those who have relatives na unfortunately nakakaranas ng health challenge, especially yung cancer na very deadly, na very very difficult din to manage, at saka hindi ko ma-sure, but it's long-term na treatment. I advise everyone to hold on firmly on your faith and believe to God that He is willing to heal. Because I want to share yung sa mga Bible stories na there is no single instance in the Bible na may sakit na lumapit kay Jesus that were not healed. All of them receive healing. So, yun yung pinanghahawakan ko na kung yung mga taong yun na gumaling, na lumapit sa Panginoon, I believe that God is not a respecter of person. Hindi siya nagtatangi, wala siyang pinipili. Kaya lahat ng lumalapit sa Kanya na makakasumpong ng kagalingan sa kanilang karamdaman, I believe that if it happened to them, it will also happen to my daughter, and it will also happen to anyone. Kaya dapat lang tayong manampalataya at lalong lumapit sa Panginoon na hindi tayo pabayaan ng Diyos. There's always, sabi ko nga kanina, there's always a purpose why God allow things to happen in our life. Yan lang po.
Thank you. Thank you so much, Miss Edna. Once again, napaka
Mm-mm.
swerte namin to have been given an opportunity na maunlakan po ninyo ng interview at ma-share sa amin ang story ni Jhen. At muli po, my name is Sheila and I am your host of tonight's episode of Simply Nature Success Series together with Miss Edna Balayas Ayawan, the mother of our youngest patient here in Simply Nature, Jhen Ayawan. We are here with you from start to healing. Maraming salamat po and good night!
I'm Edna Balayas Ayawan. I'm the mother of Jhen Ayawan, who is just 3 months when she was diagnosed with hepatoblastoma stage 3 and now improving her condition. And we trust Simply Nature.
The most prominent symptom of hepatoblastoma is a lump in the abdomen, a swelling in the abdomen, or a palpable mass in the abdomen. Other symptoms can include loss of appetite, pain, weight loss, nausea, vomiting, yellow color of the skin or jaundice, fever, itchy skin, and enlarged veins on the abdomen. The number one test that we use to diagnose hepatoblastoma will be physical exam. So a doctor would palpate around the abdomen of the infant for masses. For tumor markers, serum AFP or serum alpha-fetoprotein is more specific for the liver, and for hepatoblastoma, this tumor marker is usually elevated prior to treatment. And lastly, to definitively know for sure that the patient has hepatoblastoma is to do a biopsy. What are the complications that can arise from hepatoblastoma? Number one is damage to the liver. Why? Because hepatoblastoma is a malignant tumor. Once the liver is destroyed and because of the sheer size of the tumor, portal hypertension can develop. So portal hypertension just means that the pressure that goes to the liver increases. When this happens, the kidneys, the heart, and the lungs can be adversely affected. Another one is metastasis. Since hepatoblastoma is malignant, it can spread to the adjacent organs and to the distant organs. Spleen, the stomach, the intestine, the colon, the lungs. Management of hepatoblastoma, mainstay would be surgery, followed by chemotherapy, radiation therapy, or radiofrequency ablation. So for infants, usually parents might be a little bit hesitant for the infant to undergo surgery. So chemotherapy might be an option. Aside from chemotherapy, radiation therapy can also be. Also, radiofrequency ablation or microwave ablation if the tumor is still small enough. However, to definitively treat the patient of hepatoblastoma, surgery is the best option. Surgery also gives the best prognosis. The recurrence rate of hepatoblastoma is 20%. Survival rates have reached 80 to 90%. However, this rate again depends on the staging of the patient. So for the patient's case, she had a metastatic disease and she fully responded to chemo. So for this kinds of patients, the survival rate is 60%. This rate should not be individualized because each and every patient has his or her own profile, different stages, different treatment options. So the survival rates would vary individually. Hepatoblastoma has a predisposition to occur together with genetic syndromes, and its cause is actually genetic. However, whether or not it can be inherited or it can be passed on to the next generation is unknown.
Now, let's see how baby Jhen is doing right now.
She looks so cute! Healthy, active. Wow, I think that's a great testimony, right? That's a great testimony. So I see questions coming up from the audience, so let's proceed.
You have learned so much from that discussion by Mr. Shyan Lim, Dr. Jansen and Ms. Jhen Macanjola, our resident pharmacist. We are now in the what we call AMA or Ask Me Anything portion, so please drop your questions on the comment section. Kahit Tagalog, pwedeng-pwede po. Okay? But before we go to our questions for tonight, I'd like to greet our avid viewers, starting off with Zenaida Maranga. Okay. Annabel Noll, Remy Joy Rojas, thank you for watching. Miss Jeanette Koo from Child House, thank you for joining us tonight as well. All right, so let's not keep you waiting. I can see a lot of questions coming in. Please know that in this modern world, with the noise of different health opinions, trust the ones from the experts. To answer our questions for tonight, I'd like to call on, once again, Mr. Shyan Lim and Dr. Jansen Pankalalan. Good evening, Sir Shyan. Good evening, Dr. Jansen.
Good evening, Sheila. Good evening, Doc. Hope to see you
Hello.
on Saturday, Doc.
Yeah, good to see you again.
Yeah.
Happy to be here. Hello, hello.
All right, Sheila, let's jump into the questions this evening.
All right. Okay. Well, this question was thrown to us privately by one of our viewers. The question is it possible to travel abroad 10 hours, 10 hours travel time after 11 days after the stage 4 chemotherapy?
Yes, of course. If you're strong enough to travel, I don't see any reason not to. Yeah. Of course you can. But of course you have to get a clearance from your doctor, no? Make sure everything is in order. You have your meds with you, no, just in case something unexpected, no, happens.
I think this is the time where I would say that's why Dr. Jansen's patients and our clients, we always talk about cancer more than just dealing with the cancer itself, right? That you also want to make sure that you're strong and you're healthy, you're feeling good, not fatigued, so that cases like this, you can actually do it. You can actually fly overseas. You can go to the mall. Doc, I always remember your patient, the one that was too bedridden. And then after that, during COVID, when everybody was locked down, she was going to the malls. So again, that's just a reminder to everyone, when you're fighting cancer, you don't just focus on the cancer markers as well. That's why Dr. Jansen recommends so many lifestyle changes as well as other protocols. And here at Simply Nature, with the Simply Nature protocols, keep yourself healthy and strong so that you can live your life as normally as possible.
Excellent. Thank you for starting off really very encouraging. Okay, next question coming from Ms. Zenaida Maranga. What food should we not eat after starting to take PPARS soft gel and tablets?
Doc, that's expertise.
Yeah, very good question. I don't see any food that you should not be eating. I guess in general, foods that you are expecting to be high in heavy metals, so like seafood, you should not be eating seafood together with the tablets or together with PPARS, because PPARS it's made from microalgae. Microalgae are very strong heavy metal chelators. So if there are heavy metals in your food, the heavy metals in your food are the ones that's gonna bind to the microalgae. So the microalgae are not gonna be extracting the heavy metals from your body. So I guess that's the only consideration that you have to watch out for. So it's really nothing negative in terms of interaction. Say for example, if you are taking PPARS, then you eat this food, you'll develop allergic reactions or some, whether or not you get the full benefit. Yeah. So if you get your money's worth, in other words.
Yeah, so in that aspect, eat healthy. Once you have started on any PPAR protocol, you've invested yourself financially as well. So I think use that as motivation to eat healthy. Doc, I recently heard someone say, I saw or heard or read somewhere. It's a really interesting quote. It says, your health is not determined by what you eat. Your health is determined by what you don't eat. So if you don't eat, that's interesting, right? So if you don't eat nonsense, your health is going to be very good. So
yes.
a lot of times we are asking, what should we eat? What should we eat? But this particular viewer actually asked a good question. What shouldn't you eat? And I think on our show we always share, right? If you are a cancer patient, avoid all animal protein. Right? If you're not a cancer patient, then try and minimize your animal protein. Right? I used to be 100%. Well, 90% meat eater. I have reversed it all the way to 20 to 30%. So 70% of my food is actually vegetables. And it's not carbohydrates like potato and rice. Many people say, I eat vegetable, I eat potato. Right? No. I mean green vegetables, carrots, mushrooms. I eat a lot of mushrooms. I like them. All right, so I make the switch. But if you're a cancer patient, do avoid animal protein. And if you need protein, even familiar brands like Enlean, is it Enlean? Sorry, Ensure, right? They now have plant-based protein shakes for you. So you don't have to get the whey protein anymore. Yeah.
Yes. Doc, there's a follow-up question coming from the person who asked about the travel clearances. She mentioned that her doctor did not give her travel clearance. Is there a way to go around this one?
Okay.
Consult with you, Doc. I think that's
yeah.
important. Yeah.
Okay, here's the thing, no. If you have cancer, airlines will not prevent you from traveling. Number one, if you are walking, you don't require oxygen, the airlines will not, no. Even if you are wheelchair bound, the airlines will not restrict you from traveling. If you are oxygen requiring, then that's the time you need clearance. Okay. So for a typical cancer patient who's not oxygen requiring and who is not bedridden, even if you are on a wheelchair, you can travel. So for that matter, you do not need a medical certificate or a clearance from your doctor, hey, for you to go. So the clearance that I am talking about here is just saying that, hey, are you fit enough to travel? Would there be any untoward effect when you travel? No. So only up to that extent. But traveling per se, if you are strong enough, I mean, you can walk. You are basically independent. No. You don't need any assistance in your daily tasks. Then you can travel, of course. Yeah, but if you want to be extra sure, then I think you have to talk to me.
Yeah, because I'm just concerned, there must be a reason why your uncle did not give you a clearance, right? So trying to go around it might be dangerous. So but if you don't agree with your uncle or you want a second opinion, that's when you get a second opinion. So consult with Dr. Jansen. Dr. Jansen will probably also be able to enlighten or shed more light on why your uncle did not want to give you the clearance.
Yeah.
Right?
So here's another point, no. If your uncle knows that you are going to fly, if you're traveling, and the discussion about the clearance was not discussed during the consultation, most likely you don't need one. Yeah.
There you go.
All right.
As Sir Sean said, if you wish to be very, very safe, okay, go for a consult with Dr. Jansen Kalalan. And for those of you who wish to have a consult with Dr. Jansen, the link is in the description box, or just simply type in how to consult. Our pretty HCS will definitely get in touch with you individually.
At this point, I just want to interject, Doc, after the COVID-19, teleconsults have become so common. Doc, I just wanted to check with you, how many % of your consultations are actually teleconsult today?
Quite interesting. It's around 60 to 70%.
Wow.
60 to
So in the
70%,
past, it's the
yes.
reverse. In the past, it's, I think, 95% in person.
Yes, 90%.
Because many people, even the older elders, struggle with Zoom and Facebook and all that, right?
Yes.
Today, because of the COVID, nobody struggles with Zoom anymore or Google Meet. They don't know. So I just want to speak to all our audience. I think the fact that teleconsults allow us to avoid traffic, it's a fixed time and date. At that appointed time, your consult will start. it's no reason why you don't go for a consult now, right? You don't really have to specially make arrangements, especially if you're not feeling well or you don't drive and things like that. So I really encourage that particular viewer who asked that question, just avail a consult with Dr. Jansen and you get your clarity that you need.
Yeah, I'm surprised with the percentage, doc. Because a lot of the patients that I'm speaking with, they are always requested for a face-to-face consultation.
Face to face, yes, yes. Probably it's because I do get to see patients who are quite far from my place of practice. So I do get patients from the Visayas region, Mindanao, even at the places far from Metro Manila. So Bulacan, Pampanga, Pangasinan, all the way to Baguio, I do get patients. So yeah, it's gonna be very difficult for them to travel, not just to see me. So yeah, take advantage of technology.
Doc, that means that you are a top doctor, doc. Because that means they don't settle for the best doctor in Bulacan. They settle for the best doctor that they can find. Diba? So I mean, sorry, that's the way I look at it. If I'm going for a consult, I'm not going to say the best doctor in Makati or in BGC, right? Because with teleconsult, I can get the best doctor, period. So if your patients are consulting from all over the world, all over Philippines, then yeah, guys, that's why we're so happy to have Dr. Jansen with us. He's very much sought the doctor.
Yeah, but I'm just trying to do the best I can to help people. As many people as I can, yeah.
And we are thankful for that. Thank you, Dr. Jansen. Okay, next question coming from Miss Venus Derama from our YouTube. Are children ages 8 years old and above, can they have a chance of getting breast cancer?
As kids, no, definitely not during teenage years. Youngest patient that I had who developed breast cancer was 23, 26 years old. I forgot the specific age, but she was in her mid-20s when she developed breast cancer. She also died in her 20s, stage 4 breast cancer. Yeah,
because actually, if you get cancer so young, it will be serious, right? Because it's unusual for you to get breast cancer.
Yes. But for this patient, the family history of breast cancer is really evident. Almost every level of generation, all had breast cancer. So yeah, it was really in her genes, no? So now for that matter, if it is confirmed that you have this very strong family history of breast cancer, like every generation there is one person who developed breast cancer without even getting the BRCA1, BRCA2 gene testing, immediately you have to screen for breast cancer at age 25.
Okay. Now, I don't know whether is it urban myth or not. Many years ago, like 10 years ago, I heard like people talking about young girls after puberty, and ladies go through puberty earlier than guys, right? Developing breast cancer. I mean, in your experience, like has that, like you said, that your youngest ever was just in the mid-20s. So you've never actually encountered anyone in their teens getting breast cancer?
Yeah, none yet. In the medical literature, I haven't read of such a thing. If I ever encounter one, we're doing this every week. I'm gonna share it with you guys. So you have to be extra vigilant. However, here's the thing. I am not saying that it is impossible because the lifestyle that we have nowadays,
so different from our grandparents. Everything has
very
changed.
different. Yes, everything has changed though. It's more toxic nowadays compared to decades ago during the time of our grandparents. So there are also more and more young people who are getting cancer. So like young people like in their 30s and 20s, no?
Yes.
So if ever I do encounter a teenager who develops cancer or breast cancer, no? I wouldn't be surprised at all.
Yeah.
If ever I do encounter one in the future, but not right now. I haven't encountered.
Yeah,
one.
because
I haven't read of such a thing yet. Yeah.
20, 30 years ago, it's almost impossible to find a cancer patient in their 20s and 30s, right? When we were young, doc, a cancer patient is somewhere in their 50s and 60s, usually 60s and above. But today, it's easily someone in their 40s, and now even younger. Yeah. So everyone, we gotta really put focus on our health and cancer. You know, the last time I read a cancer statistics, it says almost 1 in 2 people will develop cancer. So that means it's a good chance at some point in your life, hopefully really at the last stage, if it really happens to you, that people develop cancer, right? So it's really our lifestyle. Doc, I know I'm just throwing something out there, but there's so many conspiracy theories. You read about, wow, will 5G give me cancer, microwave and all that thing. But just to say that our world has really changed. So what we thought is not possible, maybe later it turns out possible, because our understanding is also always being updated. Right. So the thing is, take care of your health, everyone, and stay on top of it. That's why we do our program every week. We never know 1 month from now what new understandings may be developed in the medical industry.
I actually love the question because it seems that the person who asked this one is very concerned about the next generation, trying to prevent it.
Okay. Yeah. So what you really want to do is, as Dr. Jansen always share, and what I'm trying to do as well, is take less processed food. Don't give your kids low quality food. Try and not change their taste buds. My niece and nephew grew up eating PPAR tablets. My nephew grew up chewing PPAR tablets. Even I don't chew PPAR tablets, right? So his taste buds are actually accustomed to good things. Unfortunately for me, my taste buds were accustomed to chocolate, dogs. Chocolate and pastries, right? And cakes. Yeah, so these are bad habits that we picked up. So those who are concerned in the next generation, start them young. Don't let them eat the terrible food that we eat, right? Yeah.
Exactly. Thank you, Sir Sean. Thank you, Dr. Jansen. Next question coming from Ninita Season from our YouTube as well. Is PPARS also spirulina? The latter is also a microalgae.
Oh, let me answer this one. Okay. PPAR is definitely not spirulina. And if you ever find a product that says that they are PPARS and it contains spirulina, my suspicion, all right, I won't say 100% because I never know. Okay, but I have seen these are brands that use the word PPARS. Yeah, because it's not copyrighted, right? You can't copyright the word PPARS because that's a scientific term, peroxisome proliferated activator receptors, right? So you can't, it's just like you can't patent the word orange, right? Yeah, but they don't contain PPARs. They simply use the word brand, because I've looked at quite a few of such products, and many of them are spirulina or spirulina mixed with chlorella. So number one, spirulina and chlorella are very, very two different algae. Okay, spirulina is nutritionally, I think, slight edge in the standard nutrition, like vitamin C and all minerals and all that. But in general, the superior product in general is going to be chlorella. The reason is chlorella not only has nutrition, it has CGF, which is chlorella growth factor. If you look at your infant formulas, all the ones that you see on advertisement, they always say DHA, and then they will see this thing called CGF, good for your child's brain development, right? The CGF, many people think it's cell growth factor, right? Because that's the first word that you will guess for a child, right? So the C should be cell. It's not. It's actually chlorella growth factor. So in terms of product, if I had to choose, I would always choose chlorella over spirulina. Not because spirulina is a bad product. It's also a very good product. It's just that in today's world, we are also sometimes over nutrition. We eat a lot of stuff, right? But what's unique about chlorella is the CGF, or chlorella growth factor. So in terms of spirulina, I've not seen anything in spirulina that's unique to spirulina. So usually spirulina is marketed, is explained as a wonderful superfood, but it doesn't have any nutrients that are special only found in spirulina. But for chlorella, yes, chlorella growth factor. Now, our Simply Nature PPARS come from the family of chlorella, but we are a unique strain. The standard chlorella does not contain PPAR agonists. Okay, we actually have done, our factory and farm actually has gone for court cases, and we use spectrometers and things like that, and people to show our species is different and we do contain PPAR agonists, and the others, the standard chlorella, which is a great product, does not contain PPAR agonist. Okay, so yeah, so I hope that answers your question directly. Now, so which product should you take? They are all great. So I say if you're a health buff, you can even alternate. You know, sometimes it's good to switch it around so your body doesn't get too accustomed to one. So you can take spirulina for a month, then chlorella for another, and then Simply Nature PPARS another. That's absolutely fine if you're just a normal healthy person. However, if you are ill, if you are looking for therapeutic effect, then here is where the main difference really comes and really shines, right? So, and also, I've searched on the market. I have looked at different types of extracts from microalgae, including chlorella. What we have are proprietary, that means our own unique way of extracting the PPAR agonists from our microalgae. Yeah, there's no comparison on the market. And I've been in this industry for more than 20 years, right? So I've really looked to see if there are other like really big companies that do algae farming. Yeah, I haven't seen an extraction method like the ones we use. So there. So if you're fighting an illness, then you want the PPARS that we're talking about, the medically, then only Simply Nature PPARS. But if you're general health, you're looking for health foods, then yeah, spirulina is a great product. So is chlorella, and so is our Simply Nature PPARS. You can juggle and alternate them around. But if you're looking for therapeutic effect, yeah, please, yeah, don't play with your health because you're sick, right? If you're sick, so go for Simply Nature PPARS.
Thank you so much, Sir Shyan. Okay, another question thrown to us privately. The question is, what role do alternative or complementary therapies play in pediatric cancer treatment?
Wow, Doc.
Yeah, huge, no?
Wow.
But I won't say alternative. I won't say alternative. I will just focus on complementary.
Okay.
Later on, I'll tell you the reason. Okay, so the main aspect or the main role that complementary medicine or integrative medicine plays, no, is supportive care for cancer patients. So may it be adjunct treatment for the chemotherapy, for radiation, or for whatever conventional treatment that the patient is undergoing. This is to increase the success rate, and this is also to increase or to reduce the adverse effects, the rate of adverse effects. Okay, so that's the main role. So have you? I'm sure you have encountered the question, no? What supplements do I take if I'm taking this medication or this procedure? Okay, so the supplements, integrative medicine is going to come in there. Okay, because oncologists, if you ask them, no, immediately the answer would be 80 to 90% don't take the supplements.
Or they'll tell you only take multivitamins that you buy from.
Yeah, ordinary. Yes.
Ordinary multivitamins.
Yeah. So I mean, why did you even ask the patient, your onco of this? No, why pay if you can just buy whatever, or if the onco is just gonna recommend whatever, right? So integrative medicine comes in there so that we make the proper assessment. So we assess the patient as a whole, so we know what supplements the patient needs. So it's not a blanket thing, you know, it's tailored for each and every patient. Okay, the way I prescribe, I have products that I usually go to, but the way I use the products for each patient is unique. Yeah, okay. So that's where integrative medicine comes in. During times when the patient cannot do conventional treatment anymore, that's also where we come in, because we have procedures, we have products that we can give to the patient as an off-label cancer treatment or to help reduce the cancer growth. No, at least at that level. Okay? So, yeah, and of course, no, there are thousands and thousands of products out there. How do you know which one are good quality? How do you know if this works or this doesn't? All right? So, you need people like us to make that discernment for you. Okay? So, that's the role of integrative medicine. No? And so, alternative medicine, let me just get some definitions out there, no?
Yeah, I think what's the difference between integrative and alternative? Because
Yes,
to
yes.
many viewers and patients, they are the same. Or
Yeah.
the alternative will call themselves an integrative.
Yes, yes. Because it's because of the term alternative. So when you say for example, mainstream doctors prescribes losartan for hypertension. It's a medication, right? What can substitute losartan to treat my hypertension? That is immediately classified under alternative medicine. The that's the understanding of lay people, but in actuality, when doctors talk to each other, it's not okay. So let me set the record straight, get some definitions out there so all of you guys can understand. Okay, so you have conventional medicine. So conventional medicine is the things that cardiologists, pulmonologists, mainstream doctors use, no? So they prescribe medications. Okay, so that's conventional. Anything outside from conventional will be under the realm of alternative, complementary. Okay, so what's the difference between alternative and complementary? Alternative medicine substitutes the treatment by in and of its own definition, no, own the meaning of alternative. However, alternative medicine uses procedures, products that can be evidence-based or not evidence-based. So meaning, if it's evidence-based, you have research. It has been researched upon. So when it has been researched upon, thousands of people have taken this. Clinical trials have been done. Okay, there are products under the realm of alternative medicine which have this. There are also products that haven't underwent this, no? The evidence behind their effectivity is anecdotal. So meaning, your neighbor told you that it is effective, try it. So up to that level, up to the evidence of hearsay. You cannot actually even call hearsay as evidence, no? Because it's chismis, right? So that's alternative medicine. Complementary medicine is just looking at products, procedures that has evidence. Okay, so that's complementary medicine. So integrative medicine is when we combine conventional and complementary medicine. Okay, so me personally, do I practice alternative medicine? By definition, with this definition that I have put out, no, strictly speaking, I don't practice alternative medicine. Do I classify myself as a conventional doctor? Yes. Because I prescribe medications. Okay. Do I classify myself as someone who's non-conventional? Yes, because I do practice complementary medicine as well. And I do use procedures that are quite innovative, that are quite novel at that. Meaning, the procedures that I am using are not yet inside clinical practice guidelines. No, so clinical practice guidelines are like the Bible of doctors. No, if so, say for example you have hypertension, the clinical practice guidelines will dictate what you should take first. If this happens, what you should take, what happens next. So it's like an algorithm actually. And if you have clinical practice guidelines, you don't actually need a doctor so much anymore to make that decision for you because everything's an algorithm. Computers, robots can make that decision for you already on what to decide, what's the next step. Yeah. So I hope you are understanding what I'm trying to say, you know. So integrative medicine again is combining conventional and the more innovative and the more novel techniques under complementary medicine. So these are still evidence based. So You won't have to worry if they are effective or not. Okay. Yeah. So I hope you understood these definitions. No? The definitions are quite technical and they can be quite easy to misunderstand because of all these jargons and some misnomers actually even.
Thank you, Doc. That was very enlightening. Okay, enlightening for all of us. The difference of complementary and alternative. Thank you. Okay.
Oh wait, sorry,
Go
Sheila.
ahead. Yes, yes.
Just wanted to give one advice to any viewer out there. Okay. As the years go, as every year, the medical industry is going to become more and more frayed. What I mean is there are going to be more and more new things, right? It's like things are new. All things are now being accepted. For example, now in Philippines, in Singapore, TCM, traditional Chinese medicine, is becoming more mainstream, right? So in the past, it's crazy. How can poking needles in you heal you, right? But a lot of physical rehabilitation doctors are using acupuncture very well. And now it's moving into managing cancer symptoms of fatigue, right? So what used to not be normal is becoming now more mainstream. So now we have TCM. Who knows? Maybe 5 years from now, we may have Ayurvedic, which is Indian, traditional Indian medicine, right? So these are a bit special. These medicines actually have thousands of years of history. Their history is actually longer than conventional, all right? But their approach is very different. So how do you know when something is correct or wrong? So usually I would do one thing. If you meet a practitioner and they're not willing to answer your questions, then I would say maybe take a step back from that particular practitioner. All right. Because today, I think trust is very important. And I believe listening to our programs like this, you're able to ask your doctor or alternative doctor like questions, and you should be able to notice red flags, right? For example, why do I trust Dr. Jansen? Very simple. I say a simple question. Our viewers ask a simple question. Doc, I'm taking this chemotherapy drug. Will it have a contraindication with the protocol you suggested? So Dr. Jansen can immediately answer, yeah, your chemotherapy drug is a platinum-based drug. It does this, okay, it does that. It won't have a contraindication with the protocols I'm giving you. So if you go to an alternative doctor and he doesn't even know the chemotherapy drug that you're taking, if he doesn't even know the chemotherapy drug that you're taking, how would he know whether there's going to be any contraindication? So these are little tests that you can ask, and I think it's very important that you ask. So if the doctor doesn't know anything about chemotherapy, can answer a lot of things, and he just says it's bad or whatever, then, I would say not that you give up on alternative, but go and find another practitioner who can answer your questions. So that's why at Simply Nature, in our program over here, we are so glad to be able to work with Dr. Jansen and Dr. Jimmy, because they are doctors who actually know their stuff. All right. So I hope I'm just giving you a tip on how to go about as you explore different alternatives that are out there. Make sure the person sharing the protocol to you can answer your questions, right? And make sure you research a little bit and ask some difficult questions, okay? It's okay. After all, you guys ask us very difficult questions, right, Doc? So you shouldn't spare your other doctors from the difficult questions. All right, Sheila.
I agree. All right, thank you. I just want to read some few positive comments from Ninita Season. Thank you for the enlightenment. Another one from Miss Noemi Veras. Good evening, watching from Bicol. PPARS really is nice. I'm using it since 2022 until now. Wow. Thank you for sharing. Okay, another question coming from Miss Jhen Chang-Ang. What foods can act as chelators? Aside from PPARS, what supplements act as chelators? Thank you.
Okay, remember I always tell you to eat plant foods. Yeah, because all plant foods are chelators. You know why?
All plant foods.
Fiber is a chelator.
Oh.
Fiber is a chelator.
Doc, what is a chelator? Perhaps you can help
okay.
And what is a chelator? What does chelation do?
Yeah. So chelation, if you Google this, no, the definition, simply put, is chelators are molecules, no, are substances that binds other molecules. Okay, and when they bind, they can be excreted unchanged. So if you go to integrative medicine clinics, no, I'm not gonna say chemical or substances or materials that they use for chelation includes EDTA. Yeah, EDTA. That's the main one because EDTA, when you give it to a patient, it is excreted unchanged. So in this regard, no, it can bind to heavy metals, to plaques, no, electrolytes, no, actually in general metals that yeah, it can bind it and you would excrete them. Okay, so that's the main idea of a chelator. So for food, since food you eat, okay, things or substances that when you eat you excrete unchanged, seeds, fiber in general. So if you eat corn, when you poop you see corn. So that's what a chelator is, no. However, of course, when you eat something and it goes out of your poop unchanged, it doesn't mean that it did not have any effect inside your body. It did, no. It got all the nasty things inside your body, and it acts like a broom, no, and sweeps it out through the stool. So that's what a chelator is. Now, there are foods that acts a better chelator compared to others. So one example is Simply Nature PPARS. No, microalgae specifically are very good heavy metal chelators. Okay, so that's why we use them in radiation exposures, heavy metal toxicities, yeah, in general, no. So other foods, no, aside from microalgae, like rice bran, these are good chelators as well. The outer covering of rice, yeah, that's a very good broom. Psyllium husk is also another good chelator. Okay, so for those of you who are watching right now, if some of you have tried taking Cleansing Plus, okay, Simply Nature's Cleansing Plus, if you have noticed that the when you dissolved it in water, if you notice that what you dissolved in your glass was almost the same looking as what you just pooped out, yeah, because you don't absorb psyllium husk. Largely it goes through the stomach, goes through your intestine unchanged, and that's what makes it as a good chelator, because it binds everything and it doesn't change, right? I mean, it doesn't change chemically, so you just poop it out. Okay,
So you know,
so I hope yeah.
So Doc, the main function of chelation, taking a chelator is to remove nasty things from your system, right? To pull it out.
Yeah,
Doc, I also noticed something, you know, when I take Cleansing Plus, like, and sometimes when I take a lot of PPAR tablets, my poo, oh, I'm so sorry, you know, that we talk about poo, but it's very important. My poo comes out and I see like sesame seeds kind of thing. But I know I didn't take any sesame seed at all. Then I realized these are actually mineral deposits, right?
Yes, mineral deposits, or they were sesame seeds that you
A
ate
long time.
long time ago that stayed there. So see, do you realize where where we're getting at, no? People who are watching, you sometimes see things in your poop that you did not eat recently, but just somehow came out. So imagine that was staying inside your body for such a long time already.
Yes.
It was pulled out by a product like Cleansing Plus.
Yeah, disgusting. I mean, the fact that it was in my system for so long, right? That no wonder we get sick, right?
I can just imagine that. Now I understand the reason why it Cleansing Plus is always part of the protocol. And how I can also imagine this, the prolonged side effects that we are preventing also when we take this.
Yeah. So since we're talking about pooing, chelation, I actually developed not really developed, no. I actually thought of a detoxification program. I partnered with, of course, everyone knows I already partnered with Simply Nature, but I took it one step further. So I actually not really formulated though, but took products here and there, then combined them to create a good detoxification protocol. So in this protocol that I thought of, or I formulated, I use a tea blend, serapeptase, probiotics, microalgae of Simply Nature, and psyllium husk of cleansing or cleansing plus. So 5 products for this protocol. So let me just explain these 5 products. So for detoxification, what are the organs that detoxifies our body? So that would be your skin through your sweat. That would be your liver, and that would be your kidneys, and of course your intestine. Okay, so we have 4 major organs, that helps us detoxify. So the protocol that I developed addresses these 4 organs. No, 3 only, except the skin, because for the skin, for you to sweat, you have to exercise. Okay, so for the 3 ones, liver, your gut, your kidneys. So I got a a very good tea blend. So the ingredients of the tea blend is uva ursi, nettle, dandelion, and green tea. So these 4 herbs, these 4 ingredients will help you excrete more, urinate more. Nettle is a diuretic. Then nettle and dandelion detoxifies the liver as well. Uva ursi as well. Okay. Green tea is more for the liver. Okay, so we have a tea blend, serapeptase. Serapeptase is an enzyme. So remember what Shyan shared with you a while ago, that he had some white sesame seed look like looking at things in his poop, but he didn't remember any sesame seeds that he just ate, right? So stuff can really stay in your gut for very long periods of time.
Yes.
So if these seeds stayed in your gut for very long periods of time, imagine biofilms inside your gut. Biofilms. Okay, so
what are biofilms?
Biofilms are films that biofilms are it's basically a mucus, that is very sticky. So if the mucus is very sticky, all sorts of bacteria is gonna develop inside that. So the bad bacteria can cause inflammation. And of course, since it's a biofilm, you won't be able to absorb nutrients through there. Okay, so it impedes absorption of nutrients. It inflames the gut as well. So it can cause all sorts of problem. So what is nice about serapeptase is that it dissolves biofilms. Yeah, so it's an enzyme. Serapeptase is an enzyme. So once the biofilms get dissolved, serapeptase can go inside your blood. It can get absorbed by your intestine. So when it goes inside your blood, it can dissolve plaques as well. It eats plaques. If you have cancer, it goes to the tumor. It lessens the integrity of the tumor capsule. So when we give treatment to the patient, the treatment is gonna be more effective because it disrupts the capsule of the tumor. If you have a solid tumor, okay, so that's what serapeptase does. The third one is probiotic. So that's basically good bacteria, just to help heal the gut, help with the immune system. Okay, and of course, you have your Simply Nature PPARS, very good chelators, very high in fiber, really helps with your poop, So that's the value of PPARS, and that PPARS also detoxifies your liver. Okay. Lastly, the psyllium husk or cleansing plus. I don't usually prescribe left and right. If you are someone who has constipation, then I will include it in your protocol. No, you take it for at least a month. Then just to help you poop, no. But if you are someone who poops regularly, then cleansing plus is not a requirement. So that's what I formulated, no, for detoxification. So if you want to try, please set an appointment so I can discuss this more with you. Okay.
Excellent. Thank you. Thank you, sir. Thank you, Dr. Jansen, and thank you, Sir Shyan. Okay. You mentioned about liver. A viewer messaged us privately. The question is, can fatty liver lead to liver cancer?
Yes.
Oh,
Yes.
yes.
I have one such patient already. Fatty liver, long time fatty liver. She had fatty liver for like 20 years, 20 years, no? So fatty liver, if it is left untreated, it can cause inflammation to the liver. If the liver is chronically inflamed, it fibrosis will happen. So fibrosis is like scarring. If your liver gets scarred, and and it leads to cirrhosis, that's not reversible anymore. If you have liver cirrhosis, the risk for developing liver cancer is gonna shoot up. Okay, so that's how.
Yeah, I want to add to this question. Not only fatty liver, basically to everyone that is watching, if you have chronic hypertension, right? High blood cholesterol, high blood sugar, these will definitely ultimately lead to some very serious illnesses. It won't happen in 2 years, 3 years, but it will happen over a period of 20 years. Now you will say, oh, then I'm pretty safe. The problem is once you're used to having hypertension, you will forget about it. And without knowing anything, it'll be 20 years. And then hypertension won't directly cause cancer, but it will inevitably be one of the factors, right? It will stress out your kidney, and then if your kidney starts to function starts to be compromised, your toxicity levels in your body are higher than usual, you might end up going to dialysis. That it just is the root cause, and there's so many possible ways of leading you down towards the scariest thing, which is cancer, right? So yeah, not only fatty liver, all these standard things that we're so used to, like hypertension, high blood cholesterol, high blood sugar, if you've had it for more than 5 years, tonight I hope you make a decision to turn it around, right? Don't just live with hypertension, don't just live with high blood sugar, high blood cholesterol. Okay, if you've been having it for more than 5 years, I think tonight start to make a decision to turn it around. Because if you don't, in the blink of an eye, some other medical condition will develop.
As early as now that it's just fatty liver.
Yeah.
I remember in one of our webinars, both of you mentioned that liver cancer is one of the very difficult cancer to treat. So
yeah, difficult and painful and just really nasty, compared to like breast cancer or prostate cancer, which is the slowest. Yeah.
Well, thank you, Dr. Jansen. Thank you, Sir Shyan. Next question from Ninita Season: is that formulation Serapeptise is in the market, can only be obtained through you?
No, not really. I mean, Serapeptase is not exclusive under me, no. You can actually buy Serapeptase in iHerb, but it's up to you, no. If you want to purchase from other sources, but if you want ease of purchase, then I can help you. I can help connect you through the supplier. I can even help you. I can even help purchase for you, no, because they give special exclusive discounts for doctors, so we can get it way cheaper than the SRP. So yeah, if you're interested, again, I think it would be better to set an appointment so we can discuss, no. But yeah, the products that I carry, of course, I have met the suppliers in person, so rest assured, it won't be a scam. I think that's something that is always a concern nowadays, no? Because there are a lot of online scams here and there.
You know,
Go ahead, sir.
to the viewer that asked this question, you know, because of my job, I meet so many doctors. And for me, I can tell a good doctor versus just a standard doctor. Good doctors actually think. What do I mean by they think? They actually will think about how every product works, and then they will apply their understanding to it and just go one more step, right? So there are doctors like Dr. Jaime, who's a PhD in biochemistry. You know, the way he uses Simply Nature PPARS is very innovative. That's because as a doctorate in biochemistry, his understanding of how chemical reactions in your body work and how all these nutrients interact is very different from a doctor. It's like a researcher level instead of a doctor, which is a very practical level, right? So I always can tell who is a good doctor when they, number one, can answer questions and explain why they combine the products and give a very clear reason why they do so. And of course, the one thing safe about natural is like the combinations that Dr. Jansen does, right? Is that they're not like drugs. They don't often have any negative side effects, right? And if they do, it's things that your body corrects the moment you stop, right? If it gives you LBM, stop taking it, you won't have LBM. So it's not like drugs where it has a permanent effect. And so again, there's also a big difference for all our viewers to know. There's a difference between herbs and foods. So herbs like ginseng and lingzi, or anything that most TCMs use, a lot of them are herbs. So please be careful. You don't want to use herbs for self-medication carelessly. All right, they actually have negative side effects. Do remember in Chinese medical philosophy, there is this thing called yi du gong du, which is exactly the same as conventional Western medicine. Use poison to fight poison, which is exactly what drugs do, right? Chemotherapy to fight an illness. Chemotherapy is poisonous and is being used to fight the disease. The Chinese have this understanding as well, which means that Chinese herbs can be toxic and they should only be used if you're adequately trained. So again, all these things are just good information for you to know so that you can make better decisions.
Thank you, Sir Shyan. Thank you, Dr. Jansen. Thank you. All right. And of course, from the perspective of patients and clients, what's important to us is that it's not a scam, okay? It's always legit and authentic. And I guess this is also the reason why Dr. Jansen trusts Simply Nature.
Yeah.
Okay. Okay. Next question.
I can't believe I'm saying that it's not a scam. Online. Oh my goodness, people.
But no, Doc, it is true, you know. Today there are so many things and then so many videos. Every time I watch YouTube, they have these commercials that show some foam that you spray on a frying pan that's rusted, you wipe and it becomes like totally new again. It looks so real, but I know it's a scam because I look at it closely because I manage a creative team, so I'm familiar with video editing. I know that's an edited video, it's not actual, right? Yeah, so we have to be careful. Yeah. Wait, another thing. Another thing. Who will not scam you? One of the important tests, right, is that you can interact with the person you're buying from. You know what I mean? If you buy from a company which you can't talk to them, you can't complain, or you have questions you can't ask, that's when that's dangerous because it's your health, right? So here, if you get from Dr. Jansen, you know where he is. He has a clinic. He can't run away from you.
I mean, I'm all over the place already. Yeah, so
No, I think that's something is basic common sense and wisdom for all our viewers, right? You want to go to someone who you can find again, who is accountable, right? If the person suddenly disappears, what are you gonna do? There's some side effects that you feel in your body. You don't know how to rectify it. So again, when you choose a medical practitioner, a protocol, you want to choose a company that is able to interact with you, and not only you, but many other people, so you know, okay, they're trustworthy. Where if something slightly different happens to you, you won't be without any option. You have someone to ask for advice, and you know they'll be there, and you know they'll be sincere in helping you all the way, just like Dr. Jansen and ourselves.
Exactly. Thank you. Thank you, Sir Shyan. Thank you, Dr. Jansen. Another interesting question thrown to us privately. Can my child take PPARS during chemotherapy journey? How can I ensure that PPARS do not interfere with my child's conventional cancer treatment?
You have to talk to me. I need to know the type of chemotherapy, the medication, no, that is being given to your child. Then let's just schedule, no, how you should be taking PPARS depending on how your kid reacts, no, to the chemotherapy. Yeah, so we can go from there. Yeah.
And maybe Sheila, you just make a few comments, since that's actually how we got to know you, and that's
Yes.
actually your personal journey. Yeah.
Well, I'm actually very grateful to have known Simply Nature before we started the treatment with my son before, because I run towards an integrative doctor. I say her name, Dr. Medi Dudulyon, and I was really hoping for something, an alternative, as mentioned by Dr. Jansen earlier, something that we can take or we can do apart from the chemotherapy. But to my surprise, the integrative doctor, Dr. Medi, actually begged me to proceed with the chemotherapy, but not chemotherapy alone, just because my son's condition was aggressive and already on the fourth stage. Okay, so I came to know Sir Shyan, of course, because we were bridged by Doc Medi. And what I've learned from Sir Shyan is that I will never forget this. Always ask your doctors, okay, about what's going on or what will happen to your son if you proceed with the treatment. And I was actually very amazed, okay, during the treatment, all throughout the treatment, because when I was expecting some side effects to come along, okay, even during the chemotherapy journey, while it is being done to my son was actually playing. My son was actually seated and not lying down, that's as expected. So these are things that what I can say is that we followed the advice that I've learned from Sir Shyan, Doc Medi, even from Dr. Jansen, up until now that my son is already cancer survivor. I am still learning, and I'm still vigilant. We are still vigilant with my son. And this is also something that I share with the people I talk to here in Simply Nature, with the patients and clients also, so that I can forward the gratitude that I feel towards Simply Nature persons.
Yeah, I just wanted to add, our other customer service, I don't know whether you know this, our new customer service, Daisy, her mom actually succumbed to cancer. So that's why she's so passionate in sharing and answering the questions of our viewers, clients, and patients. So, and not to say I will do this for all our clients, but when I got to know Sheila, I actually went to PGH to visit Dominic while he was undergoing chemotherapy. So that's just another thing I want to share with everyone, in the sense that if you're talking to someone whom you're taking medical advice with, they should be able to answer your questions, and you should be reliably be able to speak to them again and again, because that's the basic of accountability, right? That they're not a scam just trying to sell you one time and then disappear. So that's it. But okay, please, no promises. I'm not going. Yes, I may have visited Dominique at PGH, but it doesn't mean I can visit all of you. All right. So that's not a commitment on my part. But for Dr. Jansen, yes, you will see him in consult, right? He will always be there.
I think one more important thing that I've learned from Sir Shyan and Dr. Jansen is that the relationship that we had with our doctors in our hospital was really, really good. And we were able to follow whatever they advised us, but at the same time also following the integrative side as well. So this is something that we try to ensure also, so that you will always have a good relationship with your doctors. They are happy to see you always coming back healthily. So there. Okay. All right. Another question. Question
Last
is,
one, I think, because we are hitting 9 o'clock.
Oh yeah, 8:50. Okay. Last question for today. Can newborn screen and detect cancer? Is it a must for all newborn to undergo this test?
Newborn screening here in the Philippines cannot detect cancer. Mainly what newborn screening detects are genetic diseases. It is mandatory because it is under the law that all newborns should undergo newborn screening. This is very important because this will also give you information, no, if there are if your kid has any genetic problems, genetic diseases, because there are congenital genetic illnesses wherein you cannot feed them nuts, cannot feed them milk, or they have a special diet, or else your kid is going to develop all sorts of symptoms. You can even actually, unintentionally or unknowingly kill your child. So this is very important. This is very important. Okay. So I'll give you an example. No, G6PD deficiency. G6PD deficiency is part of the newborn screening, and actually G6PD the G6PD test. No, so G6PD is an enzyme in your blood. Okay. So I also request for this test for adults, even if for adults, so just to make sure, because there are certain procedures that I do wherein they are dependent on these enzymes, and if you are deficient of this enzyme, it can cause complications. No, so one such thing is ozone therapy, especially if I administer ozone therapy directly to your blood. Another one is high dose IV vitamin C. Okay, high dose, no, it means that I'm giving 30 grams and up of vitamin C directly to you, so through your veins, no, intravenously. So I always request for G6PD. So because we do not want to have any complications, and of course, no, if there are adverse effects that we experience or that we might encounter in the future, at least I know that it's not because of the lack of G6PD. Okay, so that's one example. Another example is phenylketonuria. Anyway, it's a medical term already, but for phenylketonuria, if you feed your child the wrong food, no, their urine smells like a maple syrup. If I remember correctly, my medicine in med school. So these two genetic diseases are only part, no, of the newborn screening. There are other diseases that they screen for. So yeah, if you are born inside the hospital, definitely you will undergo this. It's mandated by the government. Okay, and it's also in your best interest to undergo such. No, so please don't refuse the pediatricians when they want to do newborn screening for you.
Oh, is it expensive?
No. It's not.
Oh,
It's not.
okay. So yeah, screening is diagnosis, right? Yeah, correct, diagnostics. So yeah, no harm. It's different from taking something. Yeah.
It would actually help. Okay.
Yeah.
So very, very last question. Okay. Another question coming from Miss Mabel Pags. Doc, what can my child take who has colorectal cyst? My child is 5 years old. Where do you think did this cyst came from? And should he or she undergo operation or surgery?
For a choledochal cyst, okay, so choledochal cyst is where a cyst formed inside the drainage of the bile. No, so it's located just outside the liver. So you have your liver generates bile, no? So you have ducts there that drains the bile towards the intestine, and those ducts, no, we call that the biliary tree. So a choledochal cyst is where a cyst forms somewhere along that biliary tree. Okay, so you have to that cyst has to be removed. Okay, so what we know for it to go is to have it removed. No, it's to excise it. Choledochal cyst removal. It is benign. It's not cancer. Okay, but it can form complications later on, especially when your child is growing. Okay, so one such complication is when your child can develop hepatomegaly or enlarged liver. So if the liver enlarges too much, of course you're gonna have abdominal pain. The liver can get inflamed. No, the skin of your child can turn yellow. Okay, so that's obstruction actually already, because of that choledochal cyst. So it really has to be removed. Now, if you are quite concerned because, hey, your child is just 5 years old, we can try giving him Simply Nature PPARS. Give it to him for a few months. See if that cyst goes away. Because Simply Nature PPARS can help with benign tumors as well, like cysts. No, it works for thyroid cysts. It works for vocal cord cysts. It works for breast cysts. No, ovarian cysts as well. So let's just try. I'll be honest here. I haven't encountered a patient before with a choledochal cyst wherein PPARS work. No? If ever, you're going to be the first. And choledochal cyst is also quite rare at that. All right. So let's just try if you're quite concerned since your child is 5 years old. However, here's the thing. I have to see you first, no, for me to assess if the case of your child is urgent or not. Do we have time to delay surgery? Because if we do not have time to delay surgery, then you really have to go for the surgery immediately. Okay, but if we do have time, say for example, your child is relatively well. If you look at him or her, your child is basically active, with good appetite, yeah, plays around, no, physically active as well. Then probably, yeah, let's just try. Probably you'd be able to avoid the surgery. Okay, so that's my 2 cents.
That's just good news, right? For any parent of a toddler, right, that you can avoid surgery. So no harm in trying, and there will always just be positive effects for anyone taking the protocols.
Exactly. All right. Well, as you both know, our audience today or tonight are combinations, of course, of parents and even patients themselves. I'd like to ask for a very quick parting words for each one of you. Who would like to go first?
I will go first today. I'm
Okay.
feeling tired, so I'll let Dr. Jansen close. Again, just thank you everyone for watching. Your questions are always insightful, and it helps us better understand. And tonight we actually covered a lot of topics not related to PPARS, which is again, our program is really there to answer questions. We learn, you learn, and we are committed to giving you unbiased, to our best of our ability, give you what we can understand to help you make better decisions. All right. So with that, well, I think we are closing on 200 episodes, Doc. That's crazy.
Wow.
I think we have outdone. I think we have more episodes than we might have more episodes than Big Bang Theory, or we're coming close to it. Yeah, because we do it
177,
every
sir.
week.
177 to be exact.
177. You know, Big Bang
Yes.
Theory only has what, 12 episodes or 20 episodes per season. They're at 10, so 200, something like that. Wow, we're coming close to that. All right. So thank you everyone, and have a great weekend ahead. Yeah, Doc.
Thank you, sir.
Yeah, so I'm going to end this with sharing with you the workshops that I have attended this year and the workshops that I'm going to attend for at least for until the year ends. So early this year, I've attended workshops by the Philippine Society of Orthomolecular Medicine. Actually, 3 workshops at that. No, so we studied integrative cancer treatments. So we studied drug repurposing. So when it comes to drug repurposing, we we look at drugs available out there in the market. We use them as off-label use for cancer. So the goal there is either to stop the spread of cancer. It's either to that's one. Another one is to starve cancer cells. No, so it's basically to make conventional cancer treatment more effective. It's also to help stop the spread of cancer. So it's also used for recurrence prevention. Um, that's one. Another one is we've studied different natural substances that are quite good for cancer as either supportive treatment or adjunct treatment to conventional cancer treatment modalities. No, so um, I also attended another workshop of the Philippine Society on Orthomolecular Medicine, which is IV nutrition. There we learned chelation. We learned how to do high dose IV vitamin C as a treatment for cancer, no? Also as a modality to as a modality for adjunctive cancer treatment. So as a chemotherapy support. Okay. Um, I also attended the basic and advanced course on integrative medicine. This was done by Dr. Ashley Berry. He is a very famous integrative medicine physician in Australia. And he really taught us how important detoxifying is, because if you don't detox, whatever treatment you give, you're just going to go around in circles. Okay? Because for cancer, no, the more cancer cells you kill, of course, a lot of toxins are gonna be released inside your body. If you don't remove them, they're gonna stay. And this is why usually cancer patients have very heavy side effects from chemotherapy. So he always teaches us detox, detox, detox. So here I am sharing with you my detoxification protocol, and so far I am trying it out myself. It has been wonderful. So my constipation actually was gone with just in just 1 week. So it was really effective. Another workshop that I attended for this year was the annual conference of Prima. I actually encountered a lot of suppliers there, different suppliers of supplements, especially for integrative oncology. Very good supplements at that, very high quality. Some of them actually sponsored even at the Philippine Medical Expo. Yeah, I think Simply Nature was one of the sponsors there.
Yes.
No? Yeah. So a lot of a lot of really good companies out there whose goal is really to improve cancer care, no? So next month I'm going to Taiwan to learn more on high dose IV vitamin C. So our lectures are gonna be Dr. Riordan. So Dr. Riordan is I don't know if he's an American or European, but he mainly does high dose vitamin C for cancer patients. Dr. Thomas Levy, I think, is also gonna be there as a guest, no? Big names in the world of integrative medicine. Also I have I was able to talk to a company in Japan who manufactures liposomal vitamin C. So remember, vitamin C has a limit, no, in oral absorption.
Yes.
So liposomal vitamin C is going to bypass that limit. So you can actually receive high doses of vitamin C, doses more than 500 milligrams, doses at grams, no? And it's not gonna, your gut is not gonna limit the absorption of it's not gonna limit the absorption. So example, you take 1,000 milligrams of vitamin C, you're gonna get 980 milligrams inside your blood. So really amazing technology by Japan. I really love Japan. They really have wonderful products, high quality products. Yeah. So aside from that, one last, no, for November, I'm going to attend a workshop as well. So this is for Lentin. Lentin is a rice bran supplement, no, which also works really well with Simply Nature PPARS. So these are things that I am trying to integrate. So for you guys. So I hope you are also excited as I am, as there will be a lot of changes in the things that I do in the clinics, the things that I would be recommending. And rest assured, I'm going to do everything I can to keep it affordable as much as possible. Okay, so that's it for 2024. Yeah. Good night, everyone.
Well, thank you, Doc Jansen. I'm sure that as you have, I can imagine that Doc Jansen has been reaching out to a lot of us, a lot of his patients. He's all over the place actually, and a lot of clinics nowadays. Also doing a lot of workshops as well for all his patients' benefit as well. Thank you, Doc Jansen, and thank you, Sir Sean, as well for answering our questions for tonight. And we hope to see you, both of you, again next week, and of course the next weeks to come to answer all our questions again. Okay. Well, at this point, I'd like to say this is the best time for you to try Simply Nature PPARS, because we are joining the Mega Sale 99. In fact, tomorrow at 4 p.m., September 30, and we will be having our Lazada live. So please watch us, because when you purchase during the live period, okay, just during the live period, you'll actually get a free Cleansing Plus sachet. Okay, so please don't miss that one. Await for our announcement on our inbox or our Facebook page as well. Okay. Also, of course, next week I'd like to invite everybody. That's September 19, also at 7:30. The title of our webinar is actually Survive Chemo with Your Oncologist. So please, we hope to see you there. Please share this event to your friends and loved ones who are all, whether they are newly diagnosed, who are doing the treatment right now, or even in remission or already survivors. They can definitely benefit from this webinar as well. Okay, so here in Simply Nature, we are very happy when we hear a lot of success stories about cancer, and we want to say thank you for joining us today as we work together to bring hope and healing to our children and families facing cancer. Together, we can make a difference one step at a time until every child has brighter and better future. Once again, we hope to see you in the next weeks to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Today with a Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS tablet for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Now is the best time to try our Simply Nature products. Available on our official Shopee, Lazada flagship store, our website www.simplynature.asia, and our office in BGC Taguig. Order yours today. Click the link on the description box.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.